Where It's At, Pediatrics for Parents, a podcast for parents and caregivers of children. I'm Dr. Jeffery Kile, a practicing pediatrician at PAK Pediatrics in Kingston, Pennsylvania.
And I'm Dr. Alvaro Reymunde. I am also a practicing pediatrician at PAK Pediatrics in Kingston, Pennsylvania. And welcome back to another episode of Where It's At, Pediatrics for Parents, which is a podcast that we have created and where we talk about timely topics, maybe some topics that are not so much in the weeds of like day-to-day pediatrics, but more bigger topics. Some of our previous podcasts have been about how to do internet research properly or heavy metals in our baby foods and things like that. So they're kind of like things that are in the news. And basically what we want to do is digest that information for you and explain it best we can so that you guys can understand things and how we view the world of pediatrics.
And make sure if you like this podcast to let us know by liking the podcast and giving us a review. So today, episode 4 of Where It's At, Pediatrics for Parents. We will be getting into the weeds a little bit today, actually, and talking about a couple different particular topics in pediatrics. And what we decided to do was sort of poll some of our parents and sort of take, I think, what we see in the office and common myths or statements that the general public sort of thinks is, relations between symptoms and things like that and what they are, and are they myths or are they real? And so we're going to be doing our little bit of our own myth busters here at Where It's At.
Yeah, it should be pretty fun. So what we did is we grabbed all those comments, and we had quite a few. So we grabbed them, we cut them into little strips of paper. I don't think we've seen all the comments in here, so they're in this little box right here, and we're going to go one by one and try to debunk and fact check.
Yep. Some of them may be true, some of them may not. We'll see. And
see.
We have them randomly in here in the box, so we're just going to pick through. This should be a little fun podcast.
Yeah.
So we should start with the heavy metals like we did last
Oh my
time.
gosh, yeah.
Okay, so our first topic is lice and poor hygiene. So if your child has lice, doesn't mean that they're not clean or they're not taking care of themselves, or we're not taking, as parents, not taking care of our children. Is that true?
Ooh, is it true? We do get this question a lot because lice is so common, especially in those younger kids. I mean, like, oh my gosh, did I not wash my kid's hair? Or is little Timmy just like a yuck little boy? But I think this one's a myth.
I agree.
It's actually the opposite. Lice is actually attracted to cleanliness. So the cleaner you are, the more likely you are. No, I'm kidding.
Clean hair shafts, though.
Yeah, clean hair shafts.
Shiny and clean hair shafts. The lice like that.
Yeah. And I guess we could talk a little bit about lice.
Sure.
So like we just mentioned, they like clean hair shafts. And what they do, they actually feed off human blood. So they grab onto the hair shaft and take little snacks off your scalp.
Yep, and that's why you get itchy, actually, and because they're like little bites, just like you would get a mosquito bite or something gets itchy, so can the lice.
Yeah,
bites.
Absolutely. And it is transmissible, so lice can transmit from head to head, but it's not as easy as people may think. You actually have to share a hat or share a scarf. Like, for example, I'm sitting here next to Dr. Kile. If I had lice, it's not going to jump from my head to Dr. Kyle's head. It's going to be pretty much attached, and then it'll grab onto fabric. And then if you share that, then you can transmit the lice.
And I think that's why the American Academy of Pediatrics pretty much recommends that if you do have lice, that you don't have to be kept out of school for that. So that's not a reason to say you have to stay home, because it's not easily transmissible. So if there's a case of lice, being in the classroom is not really going to transmit it unless you're sharing hats or coming in very close contact where you're wrestling with somebody or something like that. So that's an important point, I think.
It's a huge point, because we do get that a lot, you know, asking for excuses because my kid has lice, and that's not an excuse to not go to school.
And if I did if I'm a parent and I did a lice treatment on my child, put a comb through it, and oh my gosh, I'm still seeing some nits in the hair, does that mean I have to retreat them immediately again or not?
No. So usually what I recommend in my practice is retreating 7 to 10 days after, because those lice will have little eggs, and those eggs will they hatch, I guess,
Right.
about a week later. Now, some products will also kill the eggs, but others will not. So it really depends on what's available at your pharmacy and what has or has not been prescribed by your doctor.
Correct. And, the other thing to remember, too, is that with that in mind, that once the lice treatment is put on the hair, it kills the lice. But you have to comb them all out. And if you don't get them all, the next day, if you look, you may see dead nits there. So that doesn't mean that you need a retreatment. Really, what we try to look for are nits that are close down near the scalp, and ones really, if you watch them, they can almost move a little bit.
You can see it.
So then you know they're alive and they really need to be retreated. But we oftentimes get phone calls that, I did the treatment and I'm still seeing nits. Well, they're probably dead, so you have to really comb them out and take your time with it.
That's a really good point.
Yeah. So, okay.
Yeah, that was a good one. That's a really common
so.
one. All right, let's pick another one here. Drum roll, please. All right, so this one is, do ear infections always need antibiotics? And that's a tricky one, I feel, but
and I think there's a lot. It depends. There's a lot of it depends.
There's a lot of
right?
it depends.
So, and I think a lot of it is how we approach ear infections is based on age ranges. So kids that are nonverbal or can't express themselves very well, I think we're more apt to treat a little bit more aggressively than the older kids, because they can't tell you, hey, my ear feels bad or it's getting better. You may not know. But in the older kids, there may be scenarios where you could do some watchful waiting, really, because believe it or not, there's a large percentage of ear infections, especially in older kids, probably over age 3. I don't maybe know that for the exact age range, but over 60% of them get better on their own without antibiotic treatment. So sometimes we're a little bit more judicious when we give antibiotics to older children if they really need it.
Yeah. So especially if that kid, especially if that ear infection or that finding of the bulging red pus-filled eardrum, if it's found kind of incidentally on a well exam, the kid hasn't had any symptoms, there's no fevers, and the kid can tell you that his ear doesn't hurt, maybe that's a kid that we can do a little watchful waiting, or active non-intervention, how I like to call it.
Right. And
sounds fancier. Sounds like I'm doing more.
And some of it even depends on the clinical scenario. So definitely if a child comes in, and even if they're older, watchful waiting might not be appropriate if they're in a ton of pain, and if they're having a fever and look ill looking, you would probably be more apt to give the antibiotic. But if a kid comes in and has a little bit of ear pain and a very mild ear infection in that older age group, sometimes we could say, hey, let's wait a couple days and see if it goes away on its own. I mean, that is a valid way to go about it, because we wanted to avoid overuse of antibiotics, because, and this could be a whole podcast on itself,
oh my gosh.
But the induction of antibiotic resistance, so that's something you always have to be careful about.
And we don't want to treat something if it doesn't really necessarily need treatment. If the body can take care of it on its own, that's, in my opinion, probably better for the body to fight it, as long as it's not affecting the kid.
Sure. And I think one of the other things to keep in mind that parents and caregivers should really remember too, that one thing as doctors, when we look in ears, to make a diagnosis of an ear infection, when we look in with that otoscope, we should see an ear that's red. There's certain landmarks that we look for, that the bones there and how the light hits off of the tympanic membrane, and if that's distorted, and there should be pus behind the eardrum, that's really important. So if someone just says, oh, the ear is red on the inside, or the tympanic membrane is red, that's not in and of itself enough to make that diagnosis of an ear infection, because you could have an ear drum that's red because of many different reasons,
Many
right?
different, absolutely. I mean, you can have and truer words have never been spoken. I was just thinking as you were saying that, I was like, oh my gosh, because how many times do we get kids from, let's say, an ER or an urgent care?
Right.
It's like, oh, I was treated for an ear infection because the ear drum was red. And I was like, oh man, was it really? I don't know. But I mean, bacteria are not the only things that cause ear infections. Ears can be red because of a viral infection, in which case antibiotics may not cause or may not help the case at all. And in some cases, giving an antibiotic to a viral infection may even cause a rash, usually about 5 to 7 days after.
Correct.
And then allergies can cause some stuffy ears, maybe a little mucus behind the eardrum that could be confused with pus also.
Yeah.
So there's a lot of different causes even for ear pain. So a good ear exam is really important.
Yeah, one of the worst things that I think when I see patients in the office that have been say to like an emergency room or urgent care in the middle of the night because the child had ear pain, and then they get their antibiotic and they get it filled, and they come into the office for a follow-up the next day, and they say to me, "Oh, Dr. Kile, I had 1 dose of antibiotics, and now he's so much better."
Yeah.
And then I look in the ear, and there's no ear infection there anymore. So true ear infections take more than 1 dose of antibiotic to get better. Just like any infection, just think if you had an infection on your finger, or an infected, hair follicle or something. When you need to take antibiotics, we generally say 2 to 3 days before you notice improvement, and that's true with ears too. So, I can think the other take-home message is there's no reason to really panic if your child at night has an ear that is in pain, because they could come to the office the next day. They don't need to run the emergency room because 1 dose of antibiotics isn't going to make it better because it takes several days to really notice improvement because it's a bacterial infection with pus, just like if you had an abscess somewhere. That takes a little while to get better.
It does. Now, that's not to say that if your kid has ear pain or anything like that, don't bring him to the doctors for another 2 days. If there's pain, come to the doctors because it may not be an ear infection. Maybe he stuck something in his ear, or maybe something else happened. So it's really important to get a doctor's eval before making that choice.
Yeah. And that's another topic that I think we could throw away all of these other topics and sit here for another half hour and wax about it. So, does cereal help my baby sleep through the night? So, gosh, if I give my baby some cereal before bed, in their bottle, will they sleep more hours at night and be more rested?
That's a good one. We get that one a lot also. And
cereal's not a sleep aid, right?
It's not. Unless you are dousing the cereal with Benadryl, it's not going to work. So the idea, I think, behind people's minds is my kid wakes up because he's hungry. If I feed the baby some cereal along with his milk, he won't be as hungry. But really, you're not adding that many calories by adding a little bit of cereal. And studies have shown that that's just not the case.
Right.
Especially if your baby's not developmentally ready for cereal. So it should never be a decision you make on your own. Some babies, that thicker formula could be a choking hazard if they're not developmentally ready for it.
And there's even studies that say if you give babies food or cereal before their development, before it's appropriate. Again, the AAP, American Academy of Pediatrics, recommends starting food as early as 4 months, or even delaying it as far as 6 months even. But children that are fed early may have a higher risk for diabetes and even obesity as they get older, believe it or not. So we really have to be careful. So, and really waking up babies at night is a multifactorial reason. It's not necessarily just because they're
It could be part of their rhythm because they're used to waking up. But yeah, adding cereal to the formula, adding cereal to the baby's bottle, whether it's formula or breast milk or whatever you're doing, doesn't necessarily mean that the kids can be sleeping.
I mean, it can even make their may change their sleep cycles and make it worse.
Absolutely. You ever eat a big meal right before bed?
Right.
You feel like crap.
Yeah,
have nightmares. You start sweating. Is that just me?
Yeah.
So myth for sure.
Okay.
Right.
I'll pick another one.
Let's see what we got.
Oh, this is another good one. Fevers are bad. So true or false? Myth or not myth? Are fevers bad for your child?
Oof. So I am a big fan of fevers. I think fevers are wonderful. I think I would be more concerned if a child had an infection and could not mount a fever response.
Right.
Fevers help us. Now, having a very high fever can cause some different issues, but I think overall, having a fever means that our body's doing a good job, or at least trying to fight a bacterial, viral, or whatever infection.
So what happens when you get a fever? So we have a thermostat in the part of our brain called the hippocampus, and that's an area of the brain that controls several things, but one is our temperature. And that really lets our body know that we need to be around 98.5, which is our, quote, normal temperature. So if your body starts to naturally get cold, and your thermostat, again, in your brain is saying, I need to be 98.5 or 98, you start to do things like shiver, put on a warm coat to try to keep your body temperature normal.
Makes sense.
So the same thing happens then if you get an infection. What you just said, fevers are actually good because they help increase the inflammatory response and help fight off the bacteria or virus. So your brain, again, in that temperature center, will say, well, I need to be 102. So then you will start to do things to drive up that temperature, just like if your body was cold. So go under covers, shiver, things like that. Absolutely. And so that's sort of how your temperature regulates. And then we take Tylenol or Motrin to sort of reset that thermostat, so to speak, to bring our temperature down. But, it's, again, nothing to be panicked about. I think there's, like parents, I'm sure you hear it sometimes, doctor, what temperature do I have to be nervous about, right? And I think 105, definitely.
Absolutely, yeah.
But less than that, like I've seen kids in my career that have been really, deathly ill or hospitalizable with temperatures of 102, 103. But I've also seen that what you were saying with low temperatures. Yeah. So it's really hard. You have to sort of use the guide of what the child looks like, right?
Absolutely. Yeah. I mean, our body temperature is one small piece of the puzzle. You have to take care of the whole child, not just the numbers game with how much the temperature. And our body does increase the temperature because a lot of bacteria and viruses, they can't replicate and multiply themselves inside our body if the temperature is higher. So really what our body's trying to do is kind of control how fast that bacteria or virus is multiplying inside our body so that our body's defenses can catch up and eliminate it properly.
Right. And, it's important to remember that when you treat a fever, you're treating a symptom. You're not treating the cause of what's going on. So, if you have a bacterial infection or a viral infection and you bring that temperature down to normal, it doesn't mean there's still not that bacteria doing whatever it's going to be doing to your body or that virus. And really, keeping the temperature down to normal might not be helping get that good inflammatory response there. And it's interesting, too, that, fevers, when we say are they good, well, evolutionarily, through billions of years, man and most species have not lost fever as a mechanism to defend themselves from bacteria and things. And in fact, cold-blooded animals like lizards and things like that, when they're sick, seek out hot rocks to lay on to bring their temperature up.
That's so interesting. That's really cool. Along those same thoughts, though, so let's say a patient does have a fever, and the mom, another really common question we get, that ties along with this is, can I alternate Motrin and Tylenol, and should I? And I always say, don't, at least in my practice personally, I tell parents, don't treat the fever, treat the child. So if the kid has a temperature of 100, 101, 102, but he seems fairly okay, he's not lethargic, he's still eating and drinking, I'm like, well, hold off a little bit maybe. But if the kid has a temperature of 99 or 100, but he looks really punky and he's tired, then I would probably give that kid a little bit of Tylenol or Motrin. And the decision to alternate every 3 to 4 hours would really be based on how the kid is acting, not so much the fever spike they get.
And also alternating can cause confusion and potentially could lead to overdose of the medicine because, you're forgetting, God, which one did I give last time? It's the middle of the night and I'm stressed about my kid being sick and I forget what I gave. So you have to be careful with doing that. And really, again, it all comes back to fever. You don't want to give the perception that I need to be altering this medicine to keep everything normal, because fever is actually something that maybe we shouldn't be afraid of, because it's actually your body trying to help itself to get better.
Yeah, I think that was a really good one, because that's a common one that we get a lot in the office. Just one last little thing with that one is also, if your kid is sick and has a fever, even if you're not alternating, I usually don't recommend, 4 hours is up or 6 hours is up, but he's due for another dose.
Oh yeah, right.
That's more of a guideline that you can give another dose if necessary in 4 to 6 hours, not you have to.
Yeah.
Because like you mentioned earlier, the Tylenol and the Motrin, and we're using brand names, but acetaminophen or ibuprofen, they're not going to cure what's causing the illness. They're only controlling a symptom.
Right. Treat the child, not the number, right?
Story.
Sort of the same thing. Some of the lab tests that we do, like white blood cell counts and things like that, that's one of the things we learn. If the white blood cell count isn't normal, but the kid looks great, you got to treat the patient in conjunction with what that number is, and use them both to decide your treatment modalities. Same thing with fever. You just don't want to look at that number and go, I have to treat it. Well, how does the child look? And what's the clinical picture? Yeah,
I think that was great. Good. All right, let's see what's next. Well, this ties to the one we did earlier. So this one says, can we stop antibiotics once symptoms are better or
that's
improved?
Perfect. Yeah. I would say that, we really can't do that, because there's a certain time frame that you need to take the antibiotics. And sort of what we were talking about maybe a little bit earlier with the ear infections and things like that, once you start giving antibiotics, there's bacteria. Take a whole bunch of bacteria that you're trying to kill off with the antibiotics. So the weak ones will all die off first. So, and then you start to feel better. But there's still bacteria there, maybe in small numbers, but those are the most resistant ones to that antibiotic. So then if you stopped early, well, then all these bacteria that were able to sort of hang around and weather the storm of the couple days of antibiotics, which are the stronger ones, then they start multiplying. So then maybe you potentially have a harder infection to treat, because now what's multiplying is all of the bacteria that were sort of like be able to weather the storm of those couple days.
Yeah, you weeded out the weak ones and multiplying the strong ones. Absolutely. So that's absolutely a big no-no. Never stop an antibiotic or any medication without consulting your doctor first.
Right. Because different illnesses have different durations of symptoms. Like, for urinary tract infections in older girls and adults, it could be a very short course. Some people say 3 days, 5 days, but then when you get into bad cellulitis, at certain body parts, it might be 14 days. Lyme's disease is 21 to 28 days, so there is a variance, and you have to make sure you're clear with your pediatrician for how long they want to take it. And even if your child doesn't want to take it, they have to take their medicine.
We have to get creative.
Yeah, that's right.
But yeah, that was another really good one.
Okay. I'll take this another long piece of paper here. Infant formula and sterilization. So what that means is, doctor, do we have to sterilize the water that we're mixing in the formula powder or not? Or can we just use water from the tap?
So again, depends.
It's a little controversial, right?
Very controversial. So I think if you're using bottled water, you probably don't have to sterilize. And then we have to define sterilize also. So I think the general recommendation from the American Academy of Pediatrics and the CDC actually is, if you're going to use tap water, first, and if you listen to our podcast on heavy metals.
Yes, that's right.
What you should do is run the cold water for about a minute first, to let all that water that was sitting in the pipes kind of flush out. And then you get the more fresh water, and then use that
that's
tap
to try
water
to stop the potentially lead that could be in old pipes. That's why you want cold water to run through.
And then so you use that water, but then you want to boil that water until it has those fast bubbles coming along. But then only boil it for a minute. And then after that, you want it to cool completely before mixing in the formula.
Because especially a lot of infant formulas now are supplemented with probiotics, and probiotics are bacteria, and we know boiling kills bacteria.
Absolutely.
So if you're using a formula with a probiotic in it, and you're just pouring boiling water in with it, you're probably killing off those probiotics.
Yeah, you're basically giving the formula a fever.
Exactly. There you go. And then the American Academy of Pediatrics also what they were saying about boiling water pretty much is that you just have to understand that if you're not going to boil your water, you need to know that your water is safe and clean, right? So you might have to do some further testing on your water source, especially if you have a well.
Oh, absolutely.
Versus city water, because that's pretty well controlled, in general. But
and I think that's a general. I think everybody should test their water, at least once every couple of years, just to see if there's fluoride or heavy metals in there, and see if you need a special filter or anything.
Right. Because if you have fluoride in your water, that's not necessarily a bad thing. That means you probably don't need to be supplemented by your pediatrician through a vitamin. You could probably just get it out of the water that you drink.
Absolutely. But yeah, so I guess.
Yeah, I think that's pretty good. I think we covered that one. Okay. Let's see what's next here in the box of myths. So sugar and hyperactivity. So if my child ingests a lot of sugar, boy, do they seem hyper, and I can't calm them down. So is that the sugar that I need to be staying away from because it's making their behavior I think too hyper?
I think this one's going to surprise a lot of parents when I say it's a myth.
There's
no data or study suggesting that taking in sugar causes hyperactivity.
Right.
I think what happens is that in these situations, kids are usually at birthday parties or it's Halloween. So there's some sort of fun activity going on with a bunch of other kids, and they just kind of get hyper because of the situation. Not so much that they ate 12 candy bars.
Right, exactly. And children with ADHD and sugar, there's really no data to support. I mean, there's something out there to say that maybe, children with ADHD metabolize sugar a little differently, but there's not enough out there to say that if, I eat sugar, that my kid's going to be more hyperactive at all.
That's not to say that you can overeat sugar, though. You should still limit it, especially processed sugars, but it shouldn't be causing any hyperactivity per se.
Right.
So that's actually a myth.
Okay.
All right. So this one reads, teething causes fever, diarrhea, and ear infections. So basically, we get this a lot too. A kid will be teething, and then mom is saying that he's tugging at his ears, or we don't know that he's teething, and mom comes in and he's like, "Oh, Timmy's tugging at his ears. It must be an ear infection."
Sure.
So what do you think?
Yeah. So teething does not cause a fever. So if your child, as a baby, has a temperature of 100.4 or higher, that's a fever, and anything less than that, we do not consider a treatable fever, something we have to look for a source for. Right. So children who are teething typically do not have fevers of 100.4 or higher as a cause of that fever. So if a child comes in and the parent or caregiver is concerned that the child is teething and now they have this fever, if they have a true temperature, we need to be looking for other reasons why, not ascribing that to teething.
Right. Teething would not be the cause of that fever. We'd have to do a little investigating.
And diarrhea, the same thing. Teething does not cause diarrhea, but oftentimes it could be associated with it because teething does occur around the time that we're starting to give children or babies food for the first time.
Exactly.
So a lot of times you can have changes in bowels because of food that we're giving. Fruits and things like that, which are higher in natural sugars, could cause a little bit of a loose stool. So it could be an association. And the same thing with the rash too, right? Children that are teething drool more.
Yes.
So they get rashes on their face and their neck just because of the drool. It's not because of the actual teeth themselves. So it's pretty much those things are associations, but not true cause and effect.
Yeah. And then with the ear infections, why they tug is whenever teeth are coming through, and you can see it in their gums, there's inflammation going on. Right. And, our tubes inside our face, the ear tubes connects to the back of our mouths. And whenever there's inflammation in there, it's so close that you may get some inflammation of your eardrum too, and that can cause a little bit of pressure, but it's not an ear infection.
Right.
So myth.
It's sort of like with strep throat. Sometimes kids will come in, older kids that have strep throat, and say, "Gosh, my ear hurts," and the parents are worried he has an ear infection. You look in the throat and it's bright red. It's just because it's so close to the ear back there that they call it referred pain. So theoretically, I guess that could happen with the teeth too. Yeah.
And as far as the temperature, since there is inflammation, one of the things that cause inflammation, the inflammation is caused by certain cells in our body. That same cell also can increase body temperature a little bit. So with the teeth, you can maybe get up to like 99 maybe. Just a slight elevation in temperature, mostly due to the inflammation, but nothing enough to call a fever. Right.
And then certainly what we don't want to do is treat tooth pain with numbing drops.
Oh, that's a great,
so that's, I think, another thing, because there's a couple reasons. One is it's really a waste of money, because we do know that if you put numbing drops on a child's gums, then they're drooling more to begin with. It just washes away. But even more importantly, too, is that numbing drop then can mix in the saliva, and then they start swallowing that. So instead of numbing the gums, you're actually numbing the whole throat. And then in kids that have a lot of drool and they're trying to swallow against a numbed throat, they could have issues with choking because of that too.
Absolutely. And not so much anymore because they were recalled, but some of these numbing medications contain a medicine that can actually cause heart rhythm changes, so arrhythmias.
Right.
That's one of the reasons why it was recalled a few years ago, because parents would use it a lot because, the baby was suffering a lot or had a lot of pain, so they kept using a lot of this numbing medication, but that numbing medication has a side effect will cause arrhythmias.
And I don't even recommend, like, some parents will say, oh, there's these natural, things we can rub on them. Because they're drooling so much, it doesn't stay there. Right. Even if it did work, you're not getting any effect from it. It's just being washed away, so you're sort of wasting money.
And the effect will probably last 15, 20 minutes anyways.
Right.
Yeah, so that was a good one.
Okay, next up. Kids will get sick if they're outside in the cold and they're wet. So, they're outdoors, it's the snow.
Oh my gosh.
The snow, they're getting wet from their sleigh riding. Are they going to get sick and get a cold or
this one's so common in my I used to hear it all the time. Growing up, in the Latino community, our grandmas were always, "Oh no, you can't get your head wet. You're sick. You're gonna get sick if you get your head wet."
Sure.
And then I'd be like, "Well, what happens when I take a shower?"
Yeah.
I'd be sick all the time.
Yeah.
So this one's definitely a myth. I think where this came from is that when we're cold, our noses will just run because it gets a little numb, and then there's changes in our blood vessels. And then, we have this vasomotor rhinitis, which basically means that we get a runny nose because the blood vessels change in our nose. But it's not that we're sick. So I think that's where the misconception comes from. But I believe this to be a myth. Being cold and having your head wet or whatever will not make you get sick.
And I think a little bit, too, is that same sort of, we're talking about the association between getting diarrhea and teething, or I get a rash and teeth. They're just associations. And really what could be happening here partly too is, more kids get sick in the wintertime when it's cold and wet outside, and it has nothing to do with the fact I'm at this point in time just cold and wet, but they were going to get sick anyway because it's wintertime and it's cold and wet season, really.
Absolutely. So being cold does not predispose you to get sick. I think that's pretty clear. All right, let's see this next one. Oh, it's another long one. This one I heard also all the time growing up. So my grandma, it's always the grandmas. My grandma was a stickler. She'd be like, she called me Alvarito. So she'd be like, Alvarito, you just ate. You cannot swim for half an hour, or you cannot swim for an hour. And I'm like, but grandma, I'm always eating. So I never got, no.
And then all the kids are just standing by the edge of the pool,
just staring at it,
waiting for the 30 minutes to be up to jump in the water.
So do we need to wait 30 minutes after we eat something?
No, we don't.
No.
And where that myth came from is that, so when we eat food, have a meal, some of the blood that circulates through our body, we get more of it directed to our digestive system because it, the blood is like the fuel of our body. So it gets directed there because those organs are working to digest the food. And there's the concern, or at least the theoretical thought there was that, well, if I eat a meal and then I go jump into the pool or in a lake or, in the water in the ocean, that some of my blood flow is going now, instead of to my muscles that need the energy and the fuel to swim, it's going now to my gut to digest this food, that I might get more cramping and fatigue of my muscles because it's not being able to get all of the blood flow that it needs because some of it's going to my GI tract.
Yeah. So unless you're planning on swimming 2 miles, I think we're pretty safe to play in the pool after.
Yeah, I think so. So,
Yeah. Another myth busted.
As long as nobody's going to throw up in the pool, right?
Oh, that'd be gross. All right, let's see another one here. Okay, so another one that I get often is letting babies cry it out is harmful. So what do you think about this one?
I don't think that's true.
I don't think it's true either.
I don't think, I've never sent a baby to the hospital because they cried.
Right.
So, that's the one thing. But, in all seriousness, I think when we talk about this, we're talking about having kids like go to sleep. And so, though it's okay to let your kid or your child cry, it's really what I tell parents. It's what their tolerance is of that. I mean, do they want to go 5 minutes, 15 minutes, or all night? I mean, that's really how the parent wants to manage that.
Yeah.
But crying does not lead to more separation anxiety. And there's been studies on this to see our kids maladapted because they were, left in their crib to cry for a while to get back to sleep.
Yeah. I was just going to mention the same thing. There have been studies saying that there is no emotional distress because babies cried it out. Now, what I think is important also to know is that while crying it out may not be harmful, if your kid's been crying for an hour, I mean, I think it warrants at least a peek to see what's going on. Make sure he's not stuck or hurt or something. So go check on him, but letting him cry out for 15, 20, even sometimes 30 minutes, as long as you're okay with it, I think that's fine. I don't think it's harmful at all.
Sure. And it has to be, again, the whole family decision has to be in that. So when I counsel parents about sleep training and things like that, I sort of try to take the whole family unit into play with that because it's not a one-size-fits-all way to address sleep training. And again, now that's a whole nother topic we could get into here about how to do that. But if you feel that you want to let your child, say, cry it out for 20, 30 minutes, but you're a nervous wreck about it, and then you go into the room and you're all nervous and upset yourself, so then that just, babies are smart, so they could sort of see that you're upset now, and then that really just makes things worse. So that's probably not the best method for you if you're going to be upset. So you have to sort of know what your own barometer is on crying, but don't be afraid if you're willing and able to let them go for a little bit. Like you said, I think it's okay.
Yeah, I think that's fine too. I'm going to get the short one.
Okay. And
wait, it's your turn.
It is.
It's your turn.
So I'm going to take the long one.
Okay.
Let's see. So, true or false, I guess this is another one. Does green mucus mean that my child has a bacterial infection? Sinus infection, right? That's the big thing. My child has green mucus, or they had a cold for several days and they had this clear mucus, and now the mucus turned green. So it must mean that they have a bacterial infection that they need antibiotics for. So that's what we get concerns about.
Yeah, so we've got some good ones here. So that's another really good one. That's also a myth. The color of the mucus doesn't tell me that an infection is worse than a clear mucus versus a green mucus.
Right.
But it can give us some information as to how long they've been sick.
Right.
So most times what happens is when we start getting sick, that mucus is clear and runny, and the contents of that mucus is typically more water and then some immune globulins and antibodies and things that our body already has. And then as the infection continues, our body's response to that infection is greater and greater. So what happens is these white blood cells, which are the fighting cells of our body, goes and attacks those mucosal surfaces where this mucus is being produced, assuming that the runny nose is due to an airway issue. And then as those cells that fight infections go to our surfaces, our mucosal surfaces, it also gets pushed into the mucus, and those white blood cells kind of give that yellow to green transition in color to that mucus.
It's actually the enzymes that are expelled, from those white blood cells. They contain iron, and those enzymes that contain iron turn things more green, because iron turns things like a greenish color. Just think about, like, sometimes when your stool's green, it could be because there's, if you take an iron supplement, it's because of the iron. Mucus really acts as a lubricant for our whole body. We have mucus in our nose, we have it in our GI tract, we have it in our throat, we have it in our lungs, and then it is a protectant, like you were saying. So it does help with the time, but it doesn't really help us understand, because I've seen kids that have had sinus infections with clear mucus, but again, what you're saying, it's the timing. So a child has a sinus infection and clear mucus, they probably got sick pretty quickly.
Right.
And then those that have had it for a longer period of time could have a sinus infection because it's just been there for such a long time. But kids can have colds for 10 to 14 days, and eventually that mucus does turn yellow or green, and therefore it, it's just the amount of time, and it doesn't need to be necessarily mean it needs to be treated.
Absolutely. And sometimes, especially kids in daycare, they can get viral infections back to back. And these symptoms, they can last 2 weeks, like you just said. So you can be sick with one thing, kind of recover a little bit, and then get hit with another viral infection that piggybacks on the first one. So you can have a runny nose for a month sometimes, and that's okay.
Yeah.
And like we were saying with the fever talk, you can't just look at one thing, one symptom. You have to look at the whole picture. So if the kid is running and playing and having a great time, and he has a green boogery nose, kid's probably fine.
Right.
Now, if the kid has a very foul-smelling mucus drainage from the nose and he acts sick, then that's a different story.
100%. 100%. And, with colds, this is sort of just a little bit more on the cold side of it, is that, in the wintertime, kids get bombarded with so many viruses for many different reasons. They're indoors, closed spaces. Our activities are more close together, so viruses are just passed more often. I mean, that's partly one of the reasons why I think we see more illness in the wintertime, is because our activities and the way we do things are different than in the summer when we're outside, more separated. I mean, that's one of the factors. It's not all of it. And then, so if they're in school and they get a cold, if it lasts 2 weeks, kids could get maybe 7 colds of wintertime, and easily, right? So 7 times 2 is 14, or even if we went up to 8 times 3 is 24 weeks.
Yeah.
So there's the whole winter, really.
Absolutely.
And it's like, so my kid's been sick all winter. Well, it's probably not the same thing.
Yeah.
And the clue I always use is when I talk to parents, well, okay, your child's been sick for 3 months with cold symptoms. Well, it has to be a sinus infection, right? Well, during that time, does it seem like that your child was getting better and then all of a sudden got worse again? And typically, that's just because they're resolving one of those viruses and unfortunately are getting another one. That's part of that 7 to 8 infections, and they're just getting compounded, Certainly, length and duration of illness, if the kid has been sick for 3 weeks, never got better, and is starting to get a fever, I mean, that's a different story altogether, right?
Absolutely. So I guess one more thing to mention, it's not related to green mucus, but there's other colors of mucus that may warrant a little bit more investigation. Sometimes we see brown or black mucus. So if you see brown or red mucus, it could be a sign that there's some blood in there. So that could be from an old bloody nose or a bloody nose overnight, or maybe he scratched his nose or something else is going on. So it's always good to get it checked out. And then a very rare one, I've only ever seen it once, and it was in residency. We saw black mucus, like pitch black mucus. And when we nobody knew what was going on. So we ended up culturing it, nothing grew. And then we did a fungal culture, and it was a fungal infection. So fungal infections can give us a black mucus runny nose. So that's pretty
very
interesting.
rare. Yeah.
Very rare.
And the red mucus, if you see some pink tinged mucus, you're okay to watch that for a little while, because when you have a cold, or you get more inflammation in the nasal tissue, and that's inflammation means you have more blood flow to that area, because your body is trying to get more white blood cells there to fight off the virus. Sure. And sometimes you get a little pink tinge just because there's more blood flow in the area. But certainly if it lasts for a couple of days or something, or it's getting worse, you definitely want to have it looked at for sure.
Cool. That was another good one. Okay. All right, this is the last one. This is actually a pretty controversial one. So, is eating bad food, does that cause acne? So chocolate, chips, and things like that. I eat that stuff. Am I going to get acne?
Right. So my thought on that is that it's the food itself is not what causes the acne, but it's part of the whole global way that we look at it. So your genes, your genetic makeup is part of what causes acne. Your lifestyle, what causes acne, is part of it, and then the foods that you eat. So it's a combination of a bunch of different things that can increase your acne. But to me, food is part of the issue, but it's not the main one. Yeah,
I think they were saying that they found an association, at least, with kids that were having a high glycemic food, high glycemic index foods tended to have more acne, and it was kind of like an indirect study. So they were, I think what the study was they were trying to see kids that were obese or overweight, and they were giving them low glycemic index diets, and they found that
meaning less sugar, right?
Meaning less sugar. Yeah. So in addition to those patients improving their weight management, they also found that their acne got better.
Wow. Foods that increase your sugar in your blood are sugars, obviously, right? So candies and things like that. But then also you have to worry about carbohydrates. So carbohydrates are like your breads and pastas and things that are bready, because those foods get metabolized down to sugars. And the thought is that they increase your insulin, because your insulin is what helps control your blood sugar. So if you eat a lot of foods that have sugars in it, or carbohydrates that get converted to sugars, your body lets out more insulin to keep your own blood sugar level in range. Right. So the thought is, if you have higher insulin levels, that may be triggering hormones that increase your acne risk, and increase hormones that increase your sebum production, which is like the oily substances, and generally just increase inflammation. So carbohydrates, sugars, and we've heard about diets that are anti-inflammatory diets, right? That are low glycemic diets to keep down your insulin levels, because they increase inflammation. So, and acne is an inflammatory. I think one of our other questions that could have came out of here is acne, is it a bacterial disease? Because I take, antibiotics for it, but it's not. That's not the root cause. I mean, it's bacteria play a part, but some of it is your inflammation.
Absolutely. And like you said, genetics plays a huge role in this, and so does lifestyle.
Yeah. Milk is another one that they're saying potentially could increase some increase in acne because of the hormones, the potential. Again, this is all theoretical potential.
Right. It was interesting that it was cow's milk and not necessarily like cheese or yogurt. So it was an association with cow's milk.
Yeah.
But again, it's a part of the story, not the full story. So I think, proper acne hygiene and in general, you want to limit processed foods and limit your sugars anyways.
If you eat a healthy diet, right, rich in low fats and fiber,
you'll be golden.
And whole grains, you'll be golden.
We're out of cards. We're all done.
Okay, so
Yeah. I think this was a really fun podcast.
we covered a lot of different
We did.
topics, and now, unfortunately, that we've covered all these, I don't think parents are going to have any questions for us anymore. We won't have jobs.
There's always something.
That's right.
But if any of you guys have any ideas for topics for our podcast, please write them down in the comments section. We'll get back to you, and we'll maybe even make a podcast out of it.
Yeah, that would be
remember
great.
to like and subscribe to our channel so that you know when we put new videos up.
And so people will know what a good podcast is.
Yeah,
right?
absolutely. And so if you enjoyed the podcast, please tell your friends. And if you didn't enjoy the podcast, tell your enemies.
That's right. And we'd like to thank our sponsor, Cole Creative Studio 16 South here in Wilkes-Barre, Pennsylvania, for providing us with these podcasts, to be the ability to get them out to you.
Yeah, absolutely.
Thank you.
Thanks.